Late last week, the New York Times published an article titled, "Why Single-Payer Healthcare Saves Money." It's an interesting enough article for those of you who aren't indoctrinated with all accredited educated journalists are actually fake news nonsense. I'll leave a link to it in the comments section if you do want to read it, but this isn't really about the article. As many of you know, from my accent and my stance on guns, I'm Canadian. So every time I see an article like this, which of course is more and more often lately, as healthcare in the United States has become a very divisive subject, what with the Republicans wanting to abolish Obamacare and replace it with something else, and Democrats telling everyone that that something else is going to cost millions of people their healthcare. Every time I see an article like this, I can't help but laugh at the fact that Americans have to try and sell each other on the idea of what we call free healthcare. It's not free, of course, it's paid for with taxes, but it's such a comfortable system. It's one less thing to worry about in a world full of shit to worry about. But so many Americans, oftentimes even poor to middle class Americans, which baffles the fuck out of me, just hate the idea. And I think it's a culture thing. I hate to say the G word again, but it's just like guns. People have this mindset, a mindset passed down from generation to generation in the US. You look after yourself, and everyone else can fuck right off. And it's so entrenched, these ideas of the evils of single-payer healthcare, universal healthcare, on both the left and the right. Just like the idea that amendments apparently can't be amended in any way. But at least with guns, the US have a few countries they can point at and go, yeah, but what about them? Yes, I've heard you. Switzerland has a high gun ownership, no gun control, and low gun crime. Therefore, this somehow means the US doesn't need to make any adjustments. But you know what else they have? Universal health care. Here in Canada, ask a conservative if they'd give up their health card and pay their own medical bills. Guaranteed, 9 times out of 10, you'll get a polite, no thanks, or a fuck off, bud. I've considered myself financially conservative at most points in my life. I'm not a huge fan of giving taxes to the government, now or ever. And I gave what I think is a pretty sizable amount to them last year, actually. But I also had to make a few trips to the doctor and to the hospital last year, too. Nothing serious. Sorry everyone who wants me to die because you don't like my opinions. That's a valid reason. But during those visits, I paid no money. I gave them my OHIP card. They said, have a seat, the doctor will be with you shortly. I was seen in a timely manner, and I walked out without a bill. In the US, an uninsured person could pay around $100 to $200 for a visit to a GP, the good old family doctor, according to a poll that Johns Hopkins did back 4 or 5 years ago, so it's probably even more now. And a hospital visit? According to The Atlantic, say you're having some headaches. I'm sure they mean migraines, no one goes to the hospital for a fucking Tylenol, but say they're so bad you want to be treated for them. Well, you're gonna have an even bigger headache when the bill is $1,500. Got a severe case of the shits that won't stop? Well, just sit on your toilet and hope you don't die of dehydration, because a trip to the doctor would be $1,960 to $2,398. Just going to have a fucking kid costs about $2,000. You're spending $2,000 just to get the fucking thing out of you. It's not even a second old, and it's draining your fucking wallet. Now I know the Kellyanne Conway solution to that is to just get a job so you have insurance because, man, no one thought of that. Stupid poor people. Why don't they just go get high-paying jobs with benefits? Which, by the way, you basically pay a tax if you are insured. You have to pay for that insurance. Unless, of course, you work for a really good company that pays the whole thing for you, but that's unlikely. There's a deduction on your paycheck of some kind every month. A Time article suggested that the average person pays about $89 a month, or did a couple years back. That's over $1,000 coming off your paycheck every year. And if you have a family, sorry you wanted to have a wife and kids, fucking idiot, because it's over $400 a month, around $5,000 a year. In Ontario, Canada, a person making between about $49,000 and $72,000 only pays $600 more in taxes for their health care. And yeah, if you don't use it all, that seems shitty, but you don't get a refund either if you or anyone in your family didn't go to the doctor. And none of that includes deductibles, co-payments, all the extras. So even with insurance, you still have to pay when you go to see a doctor. So again, I walked into a hospital last year to see a specialist. I had to go a couple times actually. And when I walked out, I paid nothing. And I'm going to pay taxes anyway. That's unavoidable. Yeah, but people die sitting in waiting rooms in Canada. This isn't a daily occurrence, but sure, it's happened before. And guess what? It happens in the US too. Sure, wait times are shorter in the States, but it's because people can't afford to fucking go, so they just don't. Congrats, people don't die in the waiting room, they just die in their homes. And yes, sometimes people from Canada come to the US for some procedures that they don't want to wait for here. But it's not because your healthcare system is better. If it was better, then the US would have a higher life expectancy than Canada, the UK, Japan, Australia. Fucking Cuba edges you out. And I know exactly how people are gonna take this video. Buckley's sticking his nose in the US's business again, libtard cucknuck. So here's the Canadian in me. I'm sorry. I'm sorry if it upsets you that I'm talking shit again about the place your mom just happened to fucking spit you out of her puss and had to pay to do so, and you decided it's sacred ground and can't be spoken poorly about. But you know what? I get it. Your mind isn't going to be changed. Mine's not going to be changed either. Although, if there was a medical procedure that could change minds, mine wouldn't cost me a fucking dime.